So this next question has to do with the sequencing of treatments, which again speaks to the fact that it's super important to see a myeloma specialist. But the question is, what treatments are available for myeloma patients who relapse after CAR T?
Very, very important question, and unfortunately a tough situation that we are dealing with, because CAR T initially has been used for later lines of therapy, as it is currently FDA approved. With time, hopefully it'll start making its way sooner in the treatment also. But when a patient has had treatment with CAR T, generally they have already had treatment with most of the standard available drugs prior to CAR T. Because the way CAR T is currently FDA approved is a patient has to have at least 4 prior lines of therapy. And generally, at least in the US system, with the first 3 to 4 regimens or lines of therapy, we've already seen and exhausted most of the available drugs. So you can imagine post CAR T, there is less drug availability that the patient has not had before or may not be resistant to. But if the CAR T response lasted long enough, sometimes we are recycling some of the drugs that were previously used, and the patient may respond to them again. Another thing to think about in that place is, from my standpoint, clinical trials are extremely important and patients must seek clinical trial options. As you mentioned, again, important to seek a specialized myeloma center. But one of the drugs that was approved in 2022, a bispecific antibody, teclistamab, and there are some other related bispecific antibodies, which have actually shown some benefit, despite the fact that they also target BCMA, which CAR T targets. But patients who had prior BCMA therapy still had a very good response rate to, for example, teclistamab or some other bispecific antibodies in clinical trials. So I don't say that everybody who's been treated with a BCMA CAR T should go immediately to a BCMA bispecific. May not be the best option in all cases, but sometimes recycling older drugs in certain different combinations, clinical trials, or options, promising options like bispecific antibodies, we do have more tools today than even what we had a year ago for patients who are progressing after CAR T cell therapy.